From the RSNA, this is the Imaging Cancer Podcast. My name is Dr. Lauren Burkard-Mandel, and I am an R4 PGY5 diagnostic radiology resident at Case Western Reserve University, University Hospitals in Cleveland, Ohio. Today, I am interviewing a former member of the Imaging Cancer Editorial Board and recent recipient of the RSNA's Research Scholar Grant, Dr. Xiaoyang Liu. This award was given for her work entitled Multimodal Integration of Radiology, Genomics and Pathology for Recurrence Prediction in Hepatocellular Carcinomas after Curative Resection. Dr. Liu is a staff abdominal radiologist at the University of Toronto. She earned her MD PhD from McGill University, completed her diagnostic radiology residency at the University of Toronto, and her abdominal and intervention fellowship at Harvard Brigham. She has won numerous additional research awards and has first authored publications in Nature, AJR, and Radiographics. Dr. Liu, what an impressive resume, and thank you so much for being here today.
Thank you, Lauren. It's a great honor to be here today. As you mentioned, not too long ago, I was actually on your side, being the one who's interviewing a grant recipient. Therefore, it's highly rewarding and very honored for me to be here today to start this discussion.
I love that. So the first question I wanted to ask you, I'd love to hear more about your project for which you were awarded the Research Scholar Grant. Please tell me all about it.
Yeah, so this research project is basically focused on hepatocellular carcinoma, which, as you probably know, is the one of the most common liver cancers and highly deadly cancer. So far, there are a wide spectrum of treatment for HCC, hepatocellular carcinoma, which we abbreviated as HCC. And in terms of recurrence and patient outcome, there's also a large variety of heterogeneity within this population in terms of how well they respond to specific treatment and the recurrence rate. And as a radiologist, so far, we have been doing quite well in terms of making the diagnosis of HCC, for example, the LIRAS algorithm. However, in terms of the biological behavior for the tumor or its genetic or molecular subtype of this tumor, us as a radiologist still have a long way to go in terms of determining the radiological phenotype in correlation with genetic subtype, molecular subtype, and how they predict whether the patient responded to a treatment or not, how likely they are to have a recurrence, and in particular, whether adjuvant treatment should be considered in the population where most likely this patient will recur after resection or transplant. So these are all considerations for treatment of HCC. And as radiologists, we can definitely play a more important role in the clinical management of these patients. And in particular, recently, let's say in the last 5 to 10 years, the personalized medicine for HCC has entered this new era where genomics has been playing a great important role in multiple types of cancers, HCC being one of them. Therefore, our project is focused on integrating the genetic subtype, the radiological phenotype, as well as pathological molecular markers in order to better predict treatment response for these population, as well as their outcome prediction. And we're hoping to be able, in the long run, to stratify subcategorize the patient into different risk group and provide them with appropriate treatment, more personalized medicine in this perspective.
So while you were talking, I was just thinking about this title and the integration of radiology, genomics, pathology. So it sounds like you probably are working pretty closely with colleagues in these fields in this project. And I also was curious about the multimodal approach. So is it different modalities you're utilizing, and kind of how are you working with these geneticists and pathologists in this project?
Yes, with any great work is always a team, right? We need different expertise. I was lucky in the sense that my PhD training was based on cancer genomics. So I have a little bit of understanding about how it works. And our center is one of the largest center which treat HCC patients. So we have a great team of surgeons, hepatobiliary surgeons, GI doctors who has expertise in liver, and we have liver pathologists, We also have geneticists on the research side who we work very closely. So, in those multidisciplinary rounds, we always discuss together how to best treat the patient. And in research, we also work very close with each other in terms of identifying the most clinically relevant questions and then approach the question together as a team. So all of these expertise are very important for a research project, for a successful delivery conduct of a research project, such as this one. Of course, there will be barriers. It's sometimes it's difficult to understand completely another field which is outside radiology. Especially, a lot of fields are fast moving forward, a lot of updated, cutting edge, new information is coming in. So it's always important for us to keep updated and be able to communicate in our colleagues' language.
And in terms of the multimodal approach, is that referring to multiple modalities that you're integrating? At our institute, I would assume it's the same. They're mostly MRI based staging and stuff like that. But is there any like new technologies or different technologies that are being integrated?
So we are using both MRI and CT on the radiology side. And on the genetic side, we're performing whole genome sequencing for HCC. So we have some idea, thanks to the current already published research about most common mutations in HCC. However, the genetic landscape, in my opinion, still needs some further elucidation for us. That's also part of the project where we'll also focus on the whole genome sequencing and identify the most important genetic subtype for predicting the outcome. By integrating the both genetic radiology features as well as certain pathological features that's already known, we think we'll have a better prediction model. And on the radiology side, we also apply radiomics features, which are quantitative features. We apply machine learning and some neural network to help trying to identify the best model to establish an optimal model for the prediction.
Thank you. That's so interesting. And I love what you said about team kind of supporting that great project and that great work. I think that's so important. And we see that in so many of our interactions in radiology, but we're not in a silo. We have to interact with all of our colleagues and it makes our work better and hopefully their work better, all of those interactions. So I really like that. One thing I was really curious about is how you decided to apply for this grant and how you heard about that opportunity.
Yeah, so our department, which is University of Toronto, sent out regular emails, call for application. This is one of the biggest radiology grants for early career people. So we all receive an email, and we have our leadership in our specific hospital are very supportive of applying for these grants. So I also received a lot of encouragement for applying. So that's how I get to know about it. And even before that, our department have multiple previous recipient of this specific grant who also give me a lot of good insights and what is this award is specifically for, the fact that it's very tailored for early career radiologists. That's why I decided to apply. And then, of course, I have mentors within our institution as well as outside of our institution who, even before the calling for application of the year that I apply, have mentioned to me that this is a potential really helpful grant for me. In addition to the support, the money support it provide for the project, there's a lot of opportunity to network with people with similar ideas, similar interests in research, both in our own level and mentors. So I think that's the reason I decided to apply for this grant.
That's great. And I love hearing about that level of support and that prior recipient at your institute. I think those things are so important when you're in these scenarios, applying for grants and things like that, to really have a roadmap of how to go about doing these things for sure. And that really bridges to another thing I wanted to ask you about. And you kind of touched on this a little bit about resources and supports that were necessary for you to apply for this grant. But if there's anything else that you'd like to expand upon in that avenue, I'd love to hear a little bit more about it.
Yeah, that's absolutely key for applying for this grant, and I guess for any potential future grants. Number one is our departmental and hospital support. I think without that, I won't be even be able to apply. RSNA, the specific grants, the year that I apply, specify a requirement for protected time, which was granted and agreed upon by my hospital department, which is the University Medical Imaging Toronto, Joint Department of Medical Imaging, and also our university department at University of Toronto is very supportive for the application. The process is that we usually screen through everybody who applies, and then within the university, the top application will be taken and submitted to RSNA. So only one application was submitted through our institution to RSNA. So there's a lot of time and efforts putting in from our department, for people to review these grants and to come up with decisions. And also, another really great support I got is from multiple mentors, actually, both inside my institution and outside of my institution, who I have been worked with before as a trainee. But at this time, at the beginning of a academic career, they had played a major role in terms of helping me to identify potential collaborators, establishing the cohort of the patient to study, different aspect for the grant application. Our hospital is in particular very supportive. Also, the research department provided us with grant writing expert to go over our grant proposal, for to see whether things make sense, if there's any flaws in your scientific plan. I find that really helpful too. And of course, the collaborative team is a key, as we mentioned earlier. Without the other people on the team, I won't be able to do anything.
That sounds like really incredible, not just departmental, but institutional support for grant applications of this scale. And as you've mentioned, early investigator and junior faculty research pursuits. So that is really incredible to hear about. That sounds amazing. And in terms of advice for budding young investigators, either trainees that are anticipating a career in academics soon, like myself, or those who are already starting an early career, what advice do you have in terms of having a career in academia and finding, as you've mentioned, kind of a good fit for your research pursuits?
That's a great question. I guess the most important one thing that I probably mentioned, it's coming from my own experience and also other people's experience, is persistence. In research, there's always going to be up and down time, whether if it's applying for a grant or submitting a paper, we can get rejected from time to time. In the recent course that I had, the RSNA grant writing course, our instructor actually mentioned that no single person will actually get a successful grant every single time. Everyone has rejected grants, just like rejected papers. If we get persistent and just believe in what we're doing and then work hard on it, just keep applying for different grants, I think the successful time will come. I think it's very important for early people like us to know that this is a fact. It's not about whether this project is good or not, whether about you're a good investigator or not. It's just a natural process. So to be persistent is a very important perspective, leading to a brighter future. Let's put it that way. Another thing I can think of is think out of the box. A research idea is probably the most important thing. And I've seen a lot of great ideas actually. So if we can come up with a brilliant idea that actually have clinical significance, and we'll be able to establish a team which can practically carry out the plan of the research. I think that's the most important thing to be successful in the academic career.
That's amazing advice. And I know you're walking the walk. So I really appreciate your perspective so much. And I appreciate you taking the time to tell me about your project today. And I wish you the best of luck. It sounds amazing. I'll look forward to seeing, where that goes.
Thank you very much, Laurent. It's a true honor to be here. I'm really happy we have this discussion. Same to you. Best of luck on the training editorial board. which I grew up from.
Yes, it's amazing to see kind of that progression from my shoes to now your shoes. So I aspire for that, and it's just really great to see. Thank you so much. Thank you for listening to this episode of the RSNA's Imaging Cancer Podcast. Please rate, review, subscribe to the podcast, or check out the journal website for articles on this topic and more.